Alrighty, and so the next one we're going to talk about is another exercise that is great to work the backside, but more specifically isolating your lumbar extensors and your glute muscles, because a lot of times athletes who have issues with recurrent hamstring strains or recurrent back problems, their glutes are actually underactive, they're turned off, and they're using their other muscles to do more of the work, where the glutes should be the primary mover of their extension exercises. So this exercise here, this is called a reverse hyper. It's a great way to isolate that. Mike is setting up so that the front of his hip bones are right at the edge of the bench here. All right, he's having an underhand grip for stabilization. He's going to keep his feet together, and at the same time, while keeping his knees straight, he's going to squeeze his glutes and just lift up till his legs are parallel to the floor. Hold for a moment and back down, touch the floor. And he's just going to work on some repetitions with this. All right, this would be a high repetition exercise. A good variation of this would be to come up and hold, and a static hold. The length of time with this hold should be similar to what someone can hold for a front side plank. So there's symmetry. All right. As he comes down as well, another option he can do, going down to the floor, and come back up. Now just holding his left leg up, he can drop his right leg to the floor. So you work some unilateral stabilization with that as well. Those are some variations that you can use for the reverse hyper exercise.
So with this type of exercise, you'd be typically treating or preventing what type of injuries?
This one is an excellent exercise for people with low back problems, with knee issues, because a lot of times if you have problems with your kneecap or your patellar tendon underneath your kneecap, it a lot of times has to do with the lack of stabilization either at the foot and ankle or up at the hips. And in that situation, the glutes may not be firing, doing the right job with stabilization. So this is a great way to isolate that area and get that turned on. That can help someone who has chronic knee issues possibly have better stabilization with that.
All right, great.
The next exercise we're going to go into is called a Russian twist. So we've talked about front side, lateral, back side. Now we're going to put it all together with some rotational stabilization. All right. So what we're going to do with this is called a Russian twist exercise. He's going to get into a seated position, can be done on the floor or on a bench. All right. And all he's going to do is just work on isolating rotation right to left while keeping good posture and having some good mobility in his low back and upper back. All right. So he's just going to work on a rotation like that. Straight line through the head and spine down to the hips. All right. Should not be slouched. Knees are in good position. The knees should not come along with it when you rotate. It should be a separation. All right. If you're very good at that, you can also bring in a med ball, or you can bring in holding tubing. You can pick the feet up. There's different things you can do to make the progression more challenging. All right. If this is challenging in itself to do from the base, one thing you can do is just come into a straight seated position. So if you slide down a little bit, there we go, and just work on that rotation, because in tennis it's so important, just like in golf and many other sports as well, that you have that rotation mobility. And that ability to get your muscles to fire in that rotation movement. So you can isolate it here as a precursor to doing that exercise, just working on good rotation without anything moving in your lower extremity, and keeping good posture, trying to use your obliques to rotate your body.
And would this again be a lower back kind of targeted exercise?
Definitely. Lower back, as well as, again, knees and also shoulders. You know, all these core exercises that we just discussed, a lot of times people who have overuse injuries in their shoulder, if you do an in-depth evaluation, sometimes trace back to being lacking in their core. So because the core helps to slow down the arm in the follow-through after the strike of the ball, if the core is not working appropriately, the rotator cuff muscles have to work harder to slow the club down, the racket down. So think golf, but same thing, golf, baseball, everything like that. It's all similar. The core has to be engaged to decelerate the body and control it so that the shoulder muscles don't have to do all the work. And that's why all of these exercises in the front, the side, the back, and rotation are important to do. And again, you want to have symmetry. You want to have front very similar to your back with your endurance and reps. You want to have your right and your left very similar, within 5 to 10% ideally of endurance, so that there is balance. The body likes to be in balance, and it's important that the body is working efficiently.
All right, great stuff.
All right, thank you.